diabetes? If you think that you are prone to diabetes, the first thing that you need to know is to understand what is the illness all about. Experts say that diabetes is a chronic disease which develop among people who have the inability to utilize the glucose in their food to be used as energy. The illness develops when the accumulated glucose stays in the person's bloodstream for a long time. Over a period of time, this amount of glucose can bring potential harm to the person's other organs, such as the eyes, kidneys, heart, and even the nerves themselves. After having sufficient knowledge about it and how the disease develops, the next step is to know what kind of diabetes that are known and acknowledged by experts and physicians. Today there are three major types of diabetes, including type 1 diabetes, type 2 diabetes, and gestational diabetes. Knowing what they are and what sets each one apart from other will help people who are prone to diabetes where to focus in trying to manage their condition. What type are you? Type 1 diabetes, otherwise known as juvenile diabetes or insulin dependent diabetes, is considered as the least common type of diabetes there is. Experts say that it is an autoimmune disease that makes the body immune system, which serves as a shield against infection, gone, not of working order, thus savaging the cells located in the pancreas, which is responsible for producing insulin. For example, especially those who are prone to diabetes, insulin is very important in breaking down the food once eaten. People who suffer from type 1 diabetes have the inability to make insulin. Thus, their bodies are easily damaged by the accumulated glucose in the body. Since they need insulin to get by, people who are suffering from this type of diabetes need a regular supply of insulin 24/7. Children and young adults are prone to this type of diabetes, but this occur at any age or can be a result of an illness. Type 1 diabetes sufferers exhibit characteristics such as onset thirst, often urination, and drastic weight loss. Next is the type 2 diabetes, which is known as non-insulin dependent diabetes mellitus and adult onset diabetes. What sets it apart from the type 1 diabetes is that the person suffering from this has the ability to make insulin. It's just that the amount produced in is not enough for the body to use it efficiently. This type is considered as the common type of diabetes, which usually develops among people who are more than 40 years of age. People who are prone to this type of diabetes are usually those who are overweight or obese and those that have sedentary lifestyle. Being a progressive disease, type 2 diabetes can also lead to more severe complications like diseases including the heart, the kidney, the eyes, through blindness and amputation or loss of limbs. People who suffer from type 2 diabetes are also characterized by slow or onset testiness, repeated urination, and loss of weight usually develop span of weeks to weeks. The last type is called gestational diabetes, which develops during pregnancy. Normally, this type of diabetes ends after giving birth, but there are also those cases in some women that develop this type diabetes as they get older. Gestational diabetes, though it is common among pregnant women, should be monitored because there is a big chance of leading to type 2 diabetes. If you are serious about knowing your status about diabetes and curing it if you have it, make sure you check out this site right here. This site is helping thousands of people getting solution to their diabetic problem. You can check it out instantly by clicking the link in my video below.